Good afternoon, everyone, and thank you very much for waiting with us. Sorry for the delay. Today, we are continuing with our press conferences regarding coronavirus disease, COVID-19. Dr. Tedros is back from his trips to DR Congo and to Munich conference. You were able to watch his speech he made in Munich on Saturday. We again have journalists following us on our Twitter account. We have journalists dialing online and watching us, dialing through phone and watching us online. Again, it's $0 if you're on the phone, and it's clicking a raise hand if you are online. We will have an audio file and we will have a transcript of this press conference. Today, beside Dr. Tedros, we have again Dr. Mike Ryan, WHO Executive Director for Health Emergencies, and Dr. Sylvie Briand, Director of Global Infectious Hazard Preparedness. I'll give the floor immediately to Dr. Tedros.
Thank you, Tariq. And good afternoon, everyone. Let me start, as I always do, with the latest data. As of 6 a.m. Geneva time today, China has reported 70,635 cases of COVID-19 to WHO, including 1,772 deaths. In the past 24 hours, China has reported 2,051 new cases, which includes both clinically confirmed and lab-confirmed cases. 94% of new cases continue to come from Hubei province. Outside China, WHO has received reports of 694 cases from 25 countries and 3 deaths. As more data comes in from China, we're starting to get a clearer picture of the outbreak, how it's developing and where it could be headed. Today, China has published a paper with detailed data on more than 44,000 confirmed cases of COVID-19. This data give us a better understanding about the age range of people affected, the severity of the disease, and the mortality rate. As such, they're very important in enabling WHO to provide good evidence-based advice to countries. We encourage all countries to share their data publicly. The data also appear to show a decline in new cases. This trend must be interpreted very cautiously. Trends can change as new populations are affected. It's too early to tell if this reported decline will continue. Every scenario is still on the table. It also appears that COVID-19 is not as deadly as other coronaviruses, including SARS and MERS. More than 80% of patients have mild disease and will recover. In about 14% of cases, the virus causes severe disease, including pneumonia and shortness of breath. And about 5% of patients have critical disease, including respiratory failure, septic shock, and multi-organ failure. In 2% of reported cases, the virus is fatal, and the risk of death increases the older you are. We see relatively few cases among children. More research is needed to understand why. This new data address some of the gaps in our understanding, but others remain. The international team of experts now on the ground in China is working with Chinese counterparts to better understand those gaps and improve our understanding of the outbreak. We thank all partners who have made their experts available through the GORN framework. WHO is continuing to work night and day on several fronts to prepare countries. We're sending testing kits to laboratories around the world. We're protecting health workers by sending personal protective equipment to many countries, and we're working with manufacturers to ensure supply. we're training health workers, we're providing advice to countries on how to do screening, testing, contact tracing, and treatment. And we have put out a call for $675 million to support countries to prepare. I thank those donors who have contributed. But we have not seen the urgency in funding that we need. As I keep saying, we have a window of opportunity now. We need resources now to ensure countries are prepared now. We don't know how long this window of opportunity will remain open. Let's not squander it. I thank you.
Thank you very much, Dr. Tedros. We have about 20 minutes for questions, not more than that, so I would ask everyone to ask one and very short questions. *9 if you are dialing in, clicking raise hand if you are online. We will start, as always, here in the room. We have 1, 2, 3, and then we will move on, please. And if you can, yes, excellent. Thank you.
Thank you. Good afternoon. Tomohiro Deguchi with Kyodo, Japanese Newswire. My question goes to Dr. Ryan on WHO's risk assessment for coronavirus disease 2019. Please correct me if I'm wrong, but I understand that WHO uses the word pandemic phase specifically for influenza outbreak cases. But should the global risk assessment of COVID-19, which is high now, turns into very high in the future, would it be safe for us journalists to say or call it pandemic in general terms? Thank you.
Yeah, I think we need to be extremely cautious in using the term pandemic. We had lots of controversies during the H1N1 situation around when it was pandemic and when it wasn't pandemic, and I think we need to be careful. The real issue here is whether we're seeing efficient community transmission outside of China. And at the present time, we're not observing that. And as such, we're not in a position to have that discussion. What we're seeing is, again, as we said previously, the majority of cases outside China have a direct link still back to China. And of that transmission that's occurred in countries outside China, the majority of that transmission can be traced through existing transmission chains. So therefore, I think we have to be very, very careful not to drive fear in the world right now, and be very cautious in using the words you have used. We've said it, the risk is very high in China, it is high regionally, and it is high around the world. That is not the risk is high of a pandemic. The risk is high that the disease may spread further. And I think at face value, that is true. I don't know if Sylvie, you may have a comment on this.
No, I think you are right. I think the difficulty with certain words is that their interpretation varies, and for general public, very often pandemic is really the worst case scenario. And so I think we need, before qualifying the event as the worst case scenario, we need a lot more evidence and a lot more data, and so that's why I think we need to be cautious, because it can really create panic. Unnecessarily, because what is important currently is that we all agree on the risk assessment so that we can all tackle the virus the same way.
Thank you very much. Then we go to Chen.
Yang with Xinhua News Agency. A joint team of Chinese and WHO experts has begun field inspections on the outbreak on Monday. So up till now, any updates on the latest findings and next steps in the coming days? Thank you.
Yes, the team have had a series of face-to-face meetings with Chinese counterparts. And it's excellent to see such eminent international experts working side by side with their Chinese counterparts now. much of the work over the last 72 hours has been in laying out and agreeing on what are those outstanding questions. We've been speaking about those unknowns, and it's agreeing what we know, agreeing what we don't know, and agreeing what is the best way to access the information on what we don't know. The team will then be able to go and visit provinces and see things on the ground and continue that work together. And again, we reflect on the fact that this is a collaboration between Chinese scientists and scientists from the international community, and it should be seen as such.
Chen, please, and then Agnes, then we will go online.
Okay. Chen from Xinhua News Agency. My question is, a WHO advisor recently said that new coronavirus could infect 2/3 of the globe. It's still today a concern of the world. What's your comments on this estimate? Thank you.
WHO works with many people around the world, and people can express views on likely scenarios. And many of you have seen the various ranges of R0 or R0 that's been proposed, and all of that is important in generating hypotheses for possible scenarios in the future. But we've dealt with this previously because we had some of the same predictions last week from other scientists. All predictions are important. Most predictions are wrong. And I think we need to be careful with that.
Agnes, please.
Yes, here.
Can you just
sorry. Yes, hello, Agnès Pedro from Agence France Presse. Today, some Chinese health officials have called former patients who recovered to give their blood in order to extract the plasma and give that to the patients who are still ill. Do you think this is a good option?
Sylvie, some details. The use of convalescent plasma or hyperimmune globulin has been part of the treatment of severe infectious diseases going back almost to the beginning of when we understood viral infection. We see it in rabies, we've seen it in other infections, and it has proven effective and life-saving in a number of different diseases. Diphtheria have been one most recently where we use a similar approach. So it is a very important area to pursue. And again, we will need to look at how it's used, which patients are most likely to benefit from its use, when during the course of the illness it will be beneficial. Because what hyperimmune globulin does is it concentrates the antibodies in a recovered patient, and you're essentially giving the new victim's immune system a boost. You're giving them a boost of antibodies to hopefully get them through the very difficult phase. So it must be given at the right time, because it mops up the virus in the system, and it just gives the new patient's immune system a vital push at the time it needs it. But it has to be carefully timed, and it's not always successful. So it's a very important area of discovery, and I believe they're starting trials on that in China. But it's a very valid way to explore therapeutics, especially when we don't have vaccines or we don't have specific antivirals.
Thank you very much.
And just to add that, of course, the protocol with this news is very important, and especially the safety, because as you know, with blood products, you can also transmit other diseases. So the protocol of purification is very important, and as well the scaling up, how many patients can get this therapy, because it's not. It's not easy to produce, and so that's why all those aspects need to be carefully assessed before we use it widely.
Thank you very much, Dr. Briand. We will go online for a few questions. Let's start with the China Daily. Can you hear us, please?
Please. Hello, do we have anyone online from China Daily? If not, Chris, can we try someone from colleagues from Switzerland? Do we have anyone online? Hello, can you hear us? That's not really a bad. Let's maybe go back to the room here. We have a friend from Irish Times who joined us for the first time, and then we may go back online later. Please.
Thank you, Paul Collins from the Irish Times. Can I ask if the speakers have any doubts about the efficiency or the effectiveness of testing for the virus, given some anecdotal cases where people were multiply tested or they were found to be negative and then found to be positive?
No diagnostic test is foolproof, and we've seen that with screening programs and others around the world, especially when tests are new and validating those tests. So that there's always a small chance of a false positive or a false negative, someone who's told they're positive when they don't have the virus, or sometimes someone told you don't have the virus and they subsequently turn out to have that virus. So it is an important consideration, and that's why clinical suspicion and intention to treat diagnosis is always very important. If there's an epidemiologic link with the previous case, and if the person is extremely ill and you get a negative test, you would always retest that patient. So the retest protocols and then validation of those samples in reference labs, especially where countries are testing for the first time, we require and ask countries to share their first 100 samples with an international reference lab so that we can validate their testing protocols. So there's a lot of checks and balances in place, but again, we rely on common sense. No test is foolproof, but what it does allow is busy clinicians and others to identify those patients who have COVID-19 and treat them accordingly.
Very much. We will try one more time to go online. We have someone calling us from Canada. Can we try?
Can we try? Can you hear us?
Yes, can you hear me?
Yes, please. Can you introduce yourself?
Yes, my name is Jean-Benoit Legault. I'm with the Canadian Press in Montreal. There are reports that roughly 100 passengers have now been infected on board the Diamond Princess. What more can you tell us on that front? And if possible, I would like to hear Dr. Briand very briefly on this matter. Thank you. In French. Thank you.
No français.
Oh, your French is pretty good, Dr. Briand.
Yes, so on this issue, I think what is clear is that it's very difficult to make sure that the infection prevention and control measures are difficult to implement in a ship environment because there are a number of factors that are very difficult to be put under control, and we have seen this in many other occasions for other infections like for noroviruses or other type of infections. So it's not specific for COVID-19. And so that's why we are working very closely with the various constituencies, the Japanese authorities, but also the chief medical officer on those cruise ships to see what would be the best measure to put in place to protect the people on the ships, but also make sure that we still stick to our objective, which is the containment of the virus. And I think this is what we are going to, that's what we are doing currently. Also be very cognizant that we need to make sure that we focus on our objective, public health objective, which is to contain the virus and not to contain the people, and making sure that we can have a right balance between the health of the population in Japan and other countries, but also the health of the people being currently on this boat. And so we need to have those balance. And it's currently quite difficult because there are still many unknowns on this virus. And so measures are implemented and assessed currently and monitored on a nearly hourly basis because we learn every day and every hour more about this disease and this virus.
Can you please just shorter version in French?
Okay, this time. Okay. Donc, effectivement, nous travaillons de concert avec les autorités japonaises, mais aussi les autorités, les médecins qui s'occupent de ce type bateaux et de croisières, pour essayer de trouver tous les éléments qui vont nous permettre de gérer ce risque sur le bateau. Comme il y a encore énormément de choses qu'on ne connaît pas sur ce virus et sur cette maladie, on met en œuvre les mesures qui nous semblent le meilleur possible pour protéger la santé des gens qui sont sur le bateau, mais aussi protéger la santé de la population japonaise. Et donc, nous sommes constamment en train d'essayer de trouver le bon équilibre pour toutes ces mesures. Et comme je l'ai dit en anglais, l'objectif est de contenir le virus, mais pas nécessairement de contenir les personnes, c'est-à-dire l'objectif n'est pas de les empêcher de voyager, mais bien et juste de préserver l'intégrité physique et la santé de différentes communautés.
To the owners of the Western Dam and the Crown Prince, the Princess Princess, because they've been exceptionally open, transparent, and cooperative throughout this whole process, and that's something we deeply appreciate.
Thank you very much. Let's try to get Sarah Jerving from Devex. Sarah, can you hear us?
Yes, thank you. I just had a question about the reported figures. So in your daily updates, WHO is reporting laboratory cases, but at the beginning of this press conference, you used laboratory plus clinical cases. I'm wondering what the media should be reporting, laboratory or clinical cases.
The data we received this morning doesn't disaggregate between the laboratory and clinically confirmed cases. That's why we've reported that gross number. I believe we will continue to report both numbers as they're made available, but I think the overall number combined of both will probably be a better number going forward. But we're working with our colleagues in China to see whether they will be reporting both numbers on a daily basis from here on in.
Thank you very much. Let's try to get quickly one or two more questions before we conclude. Michael from CNN. Can you hear us, Michael?
I can hear you. Can you hear me?
Yes, please. Go ahead.
Okay, Michael Bosticki here. I'm a contributor to CNN. First of all, I'd like to salute you for your great information sharing efforts. I'm sure I speak on behalf of everyone that we're very grateful. Mr. Director General, at the beginning of the outbreak, you mentioned how important media are as partners and how important information sharing is. I'm sure you've read the same stories we have about video bloggers and others in China being arrested or detained or simply put under quarantine. And I'm wondering, given that kind of choking of information, if you will, whether you're prepared to address this issue with the Chinese authorities and remind them of how important during an outbreak like this is free flow of information, as long, of course, as it's accurate and verified. Thank you.
Mm-hmm. Would you like to?
Yeah. No, we always encourage and would always encourage openness. We say the same, and one of our own principles here is we don't, when we get misinformation, our job is not to go after the people who release misinformation. It's to put out good information and give people the best information. So it's not about going after the messenger. And we do encourage openness and transparency at all levels. It is the best way for public health to do its job. And it doesn't matter what country you're in, it doesn't matter what level you represent. So openness and transparency is the way forward. And we do always, like in the case as Sylvie referred to, the quarantine ships, we always have to balance the public and common good against the rights of the individual. And sometimes that's a very difficult balance to strike. And that has been a historical balance to strike. And we've seen that in 1918 in the Great Pandemic, where governments, including your own in the US, had to make some very difficult decisions about quarantine, very difficult decisions about information sharing, and that is, it's something that you can't ignore, and it's very important that all governments are able to balance the good of society and the community against the rights of individuals to openly communicate.
Thank you very much. I think we have time for one more question.
Thanks, yes.
But short one, please.
Hugo Miller from Bloomberg News. Dr. Ryan, you were just talking about protecting the rights of individuals. And although travel advisories are to be taken very seriously and not entered into lightly, is it too early to talk about any kind of a suggested travel ban on cruise ships, even within certain regions, to steer clear of Asia, to preclude the situation where you have to make these difficult choices between keeping people corralled on a ship for weeks on end?
I think I take your point, but even the construct of your sentence, to steer clear of. We have a group of people saying we should steer clear of cruise ships or steer clear of airports or steer clear of certain ethnic groups and steer clear of other things. We have to be really careful here. There's no zero risk in the world for anything. What Sylvie mentioned is we need an approach to managing risk that allows us to continue to operate as a society while minimizing the risks we know about. And that doesn't matter if we're talking about travel or meetings. It doesn't matter if we're talking about cruise ships. These are manageable risks. And again, we need to reflect on the fact that the vast majority of these cases are within China. When you look at the population attack rates within China, and you look at even within Hubei and Wuhan, we're talking about an overall attack rate of about 4 per 100,000. It's, this is a very serious outbreak, and it has the potential to grow. But we need to balance that in terms of the number of people infected. Outside Hubei, this epidemic is affecting a very tiny proportion of people. So if we're going to disrupt every cruise ship in the world on the off chance that there might be some potential contact with some potential pathogen, then where do we stop? We shut down the buses around the world, and what happens when other countries are affected? Do we take the same measures in that case? So we need to be extremely measured in what we do, and everything we need to do needs to be based on public health, it needs to be based on evidence, it needs to be based on a principle is there's no such thing as a zero risk, and every single person on this planet understands that. It is impossible to reduce risk of anything to a zero.
To add to that, measures should be taken proportional to the situation, based on public health, science, and evidence. And blanket measures may not help. So that's what we're trying to say. Otherwise, as Mike said, there is no zero risk, but it has to be proportional to the situation.
What do you think of transport as opposed to leisure, in the sense that transport and buses, trains fit into one category, cruise ships is a perhaps cleaner line, but...
Sure. But again, there were
risks.
There were some specific risks associated with a small number of cruise ships. And again, the risk of that has waned. So I think we again need to be realistic about what has happened, but very often in life what has happened doesn't determine what you do next. So I think we need to separate the past from where we are now. What's the evidence now? And then where do we go from here? So I fully take your point and I fully take your concern. But we need to remain very balanced before we knee-jerk ourselves into unfortunate situations. And I particularly would say in the case of stigma, and if we leave aside the issue of cruise ships, if I don't get to take my cruise ship holiday, maybe that's not the end of the world. But there's a lot of people around the world who've suffered stigma and profiling and other things. And we should maybe be concerned about that and ensure that people around the world show solidarity with those affected and don't extend risk beyond what's reasonable. And again, we need to avoid stigma at all costs.
Thank you very much, Jamie. I'm really sorry, but we'll have an opportunity again, and our guests have to go now, so we will conclude here. Thanks everyone for watching, and we will have audio file and transcript. Please follow us on our social media platforms and on the website. Situation report will come again tonight. Thank you very much.